Welcome to ThinkTech Hawaii Business Education Spotlight. I'm Alice Li Hagen. Today with me I have Dr. Warren Wong. He's a retired geriatrician with Kaiser Permanente in Hawaii, and he had been practicing for over 30 years. But he's still currently a clinical professor at the University of Hawaii John A. Burns School of Medicine. Welcome, Warren. It's
Thank you so much.
Really nice to have you here. Now, today we're going to talk about aging population.
Okay.
It's an issue that has been in the news and the media very frequently, and I hear stories, friends of mine who have to take care of aging parents. And of course, in November 2013, actually Jay interviewed Audrey Suga Nakagawa here in ThinkTech Hawaii, talking on this, I guess the interview is on a similar subject on how we can support our senior population in Hawaii. So today, my conversation with you would be from your perspective as a geriatrician, and I know that you are doing some interesting work trying to help senior population live a quality life. So maybe for the viewers' benefit, maybe you can tell us about some of the challenges in our state right now with our growing aging population.
Yeah, well, I think everybody knows we have a big population of older people that's really expanding with the baby boomers. And one statistic that we talked about was the number of people over the age of 65 compared to the number of people who are of the traditional working age, 18 to 64. And right now the ratio is about 4 working age people for every 1 person who's age 65 and older, but within 20 years it's actually only going to be 2. So it's only 2 people within the historically normal working age for every 1 person who's older. And then on top of that, there's actually going to be more older people than there are young people in the state of Hawaii.
Wow, so in the very near future, this ratio may actually reverse to the fact that there may be more older people versus young people. So how does Hawaii compare to the rest of the mainland?
Well, I'll talk about it from a couple of different perspectives. Number one, the average life expectancy in the state of Hawaii is actually the longest of all states. And people have different reasons they think may account for this, but it's not just because Asian people live longer. It's also true that Caucasian people in the state of Hawaii live longer than Caucasian people on the mainland. And when you look at the overall healthcare system in the state of Hawaii, that's actually overall a relatively good system of healthcare. If you look at parameters of health together with the cost of care, actually Hawaii does extremely well. It's also, when you look at specific indicators of healthcare for older adults, there was a survey that actually said that it was in the top 2 in the country.
But you're talking about the health care, so it's good to know that we have relatively good health care so that people can live longer. But I presume it's also the natural environment that supports this good health care system that we have.
It could be a little bit about a natural environment. In terms of health, other states that have very good health statistics are not necessarily warm states. For instance, Minnesota actually has very good health statistics, but it's not definitely not a warm state. I think that there is some degree of correlation between healthcare services and overall healthcare. Hawaii has a long history of relatively comprehensive health care. And when you look at states with relatively comprehensive health care versus states that don't have such comprehensive health care, the states that have more comprehensive health care generally have better health care statistics.
Okay, so we have a good environment for people to grow old here. Our healthcare system is relatively good. So what are the unique challenges?
Well, the good news and the bad news, right? Hawaii is not particularly unusual in that the financial status of older adults varies quite a bit. We have about 20% who are within 200% of poverty. So a relatively high number who are relatively close to poverty. You have another 20% who are actually financially relatively well off, and then you have the middle 60% who are a little bit vulnerable.
Okay.
And the cost of care, when it can accelerate quite a bit as people get more frail. You know, some people know the statistics about what it costs to live in a nursing home, and you know, there's increasing numbers of senior living communities, and the cost of those is variable, but can be quite expensive as well. And I think what's happened in the state of Hawaii is that in the last 10 years, there's been really a burgeoning of these senior living communities, so that you know, Arcadia, of course, was the classic senior living community, but then Hawaii Kai started to develop some. One Kalakau came up, Kahala Nui, all these have come up, Plaza, and so what's happened in the last 10 years is these large number of senior living communities that have catered to people who have enough money.
And you're talking about the 20%
Right.
of the senior population. And I'm glad you're talking about the business opportunity, but that only addresses, you said, 20% of the population who could afford to live in these assisted living homes. So what happened to the 60% that's in between, and of course the 20% who is in extreme poverty? Yeah,
the 20% that's in extreme poverty, they either, you know, if they get into the circumstance where they really need a lot of support, a lot of them will eventually get to the point where they qualify for Medicaid. But the real opportunity is trying to figure out solutions for the 60% who actually will not be able to afford these senior living communities, but who will continue to living in the community. And how do you come up with a solution that meets the needs for these people's quality of life without becoming impoverished? You know, so when you want what you want, you know, I mean, the Executive Office on Aging has its overall vision is that Hawaii would be the best place to live for older people.
Okay.
And so, how do you create the best place for older people to live? And I think about that a lot in terms of if we get old ourselves, do we get older looking forward to being a part of this community? And do we feel that in this community we have a sense of social well-being, and as well as emotional well-being? And the social well-being, of course, has a couple of domains. First of all, we don't want to become impoverished or have our life assets depleted in our old age. That's one aspect of social well-being as we get older. The other aspect of social well-being as we get older is we don't want to live in conditions that we're not cared for, we don't feel supported. And then the other aspect of it is the emotional well-being. Do we feel connected? So I think, you know, how do we come up with a community in which we support ourselves as older people in ways that maintain social well-being, maintain so that our finances aren't depleted, that we're supported, and that we also feel like we have a meaning in society and won't feel lonely. Those are all probably the important things about.
And I presume you came to this conclusion, and I guess people are talking more about this. It's not so much the the medicine, treating the illness or sickness, but you're really talking about quality of life here. So is this something that you've seen over the last 30 years, having treated so many of these senior patients of yours?
Yeah, I think that what you do is, well, I think I'd like to think that geriatricians care a lot about older people, and not just about their diseases.
If I can interrupt you, I remember I was mentioning to you about the article that you did an interview in 2010, and you commented what a geriatric physician should be about treating disease versus looking. Do you remember that quote that you mentioned? Maybe I can read it to you. You said you like to think of geriatrics as a little bit about understanding the disease and a whole lot about understanding the social aspects.
Yeah.
And that's what you are referring to right now.
Yeah.
So has these, I presume these issues are still in place, people talking more about it, but I think with the healthcare system, we don't seem to see that they are integrated. Healthcare is about healthcare. Quality of life seems to be something else. Is that a fair assessment of that?
Yeah, I mean, I think what we accomplished as geriatricians basically is, as much as anything else, we really, as geriatricians, we specifically say your life is important to us, and the quality of your life is important to us, and we provide that level of support. But whether our society as a whole does that is a different question. And we work within. I think that geriatricians work within a healthcare system, but basically it's not really a healthcare system. It's a sickness care system. So it's all about how to treat different diseases, and we go farther and farther down that path of trying to treat disease, and we don't. I think that it gets us further and further down the path of not having a holistic sense of how do we support older people in the community in a way that becomes not a burden financially for our whole society, because I think that that's actually a very important issue as we think about older people. Is that, it's easy to say, oh, there's going to be a lot of older people and we are not going to be able to afford those older people. I actually think that's an incorrect way of thinking.
I like to explore more of that, to look at this as in a holistic approach, and how do we utilize an older person as assets rather than a burden. We'll take a break for now, and then when we come back, we can explore those topics. My guest here is Dr. Warren Wong. He's a retired geriatric doctor with Kaiser Permanente. We'll be right back and to talk some more about how we can improve the quality life of our aging population. Stay tuned.
Aloha, this is Keli'i Akina. It's my privilege to be the host of Ehana Kako, a weekly program on the ThinkTech Hawaii Broadcast Network. Ehana Kako, what does that mean? Well, many people have heard of E Pule Kako, let's pray together. Ehana Kako means let's work together. Let's work together to build a better economy, government, and society. And every week, Monday from 2 to 3 o'clock, you will see movers and shakers and other people who are working together to build a better economy, government, and society. Again, I'm Keli'i Akina on the Ehana Kako weekly program on the ThinkTech Hawaii Broadcast Network. Aloha. See you here Mondays, 2 to 3.
We'll talk about
Welcome back. This is Alice Li Hagen with ThinkTech Hawaii BizEd Spotlight. My guest is Dr. Warren Wong. He's a retired geriatric physician with Kaiser Permanente, also a clinical professor at the UH Japsum. We are here to talk about our aging population. Before the break, we were talking about some of the challenges on working with or providing quality care for our aging population. Now, you were mentioning that we are going down the path of just treating certain ailments, but we should really be looking at it from, in a holistic approach. Can you comment on that or clarify that?
Well, I think that, whenever we invest in one way of thinking about things, we become more and more heavily invested in that, to the point of where the way that we think about it has become problematic. So when you look at the cost of healthcare in the United States as a percentage of overall GDP, it actually in the United States matches most other European countries until people get older, where the cost starts to accelerate quite a bit. And part of the reason is because there's Medicare coverage for everybody. But basically, when we think of older people in terms of sickness care, we go down further and further the path of something which eventually becomes relatively low value, in which we do very little to improve the quality of life, but at a relatively high cost of care. I'd like to think that we should place more emphasis on things that we can change and are impactful. I was mentioning a lot about social well-being and emotional well-being, and you know, people would say, well, so there's a statistic that generally across the United States, people over the age of 60, about 40% express some degree of loneliness. And I'd say, well, that's not a healthcare problem. It's definitely, and I beg to disagree. It's not a sickness problem, but it is a health. It's a mental wellness, emotional wellness problem, and it actually has an impact on overall healthcare costs.
Tell us about the impact.
Well, when people express loneliness, the likelihood of having functional decline, the likelihood of death is increased by about 45%. So you know, the real threats to a person's well-being are loneliness, loss of purpose, and dependency. And we really need to pay attention to those, because, well, those are laudable, but actually in terms of overall health, we look at it from the perspective of what do older people really want in society. They don't want to live forever, but older people do want to live in a society in which they can say, it's fine. I enjoy living in this community, and it supports me in the ways that I want to be supported.
I know you're really passionate about this subject, and you've given it a lot of thought to possible solutions. Ms. Producer, can I ask you to bring up that image of that gold card? Okay, Dr. Wong, I know that this is one of your ideas. Would you like to explain to our audience what this gold card concept is and how that would improve the well-being, emotional and social well-being of our aging population?
Yeah, so this is something that I came up with when I was spending a year at the Institute for Healthcare Improvement, and it basically said, what is the important goal that we're trying to achieve with older people? It's not to get them to live, but certainly the concept of living with love and dignity. I mean, that resonates. And
maybe you can explain why it spells gold. May I have the image again?
Yeah, so it's an acronym. It's GOLD, getting older with love and dignity. And
thank you for the image.
So it was a concept that what does that mean? From older people, it means I have a sense of identity, I have a place in society, what I think matters. And so the whole concept of a gold card was basically declarative. Anybody could say, I want a gold card. I want love and dignity in my life. So it could start off with somebody just applying and say, I just want a gold card. And the interaction with the gold card could become much more expansive in terms of a person could talk about, these are the things that I consider important in my life. These are the things that the wish that I never had fulfilled. These are the things I still look forward to now. And they can keep it very personal. They can just make it a private record just to themselves, or they can start sharing it. It's totally dependent on what they want to do. If they wanted to share with, then they can start to develop a community around specific interests, whether it's around sports or around any specific hobbies, and just the whole concept of developing community. And part of it is that I'm very much against the concept of older people are now the burden on society, because older people are actually very powerful. So if they organized as powerful people, let's just say that let's just say in Honolulu, that 50,000 people had gold cards. And let's say in Houston that 50,000 people had gold cards. Let's just say that the gold card holders in the city of Houston said, on a 5-star level, living in Houston has 3.5 stars for living as an older person. Honolulu has 5 stars. Well, what is the political power of saying this is a great place to live for older people? And what does it mean for the spiritual sense of that whole community to say this is important? And then what if with the gold card you're able to identify specific problems, like whether there's pockets of depression in certain areas, or pockets in which, the access to transportation. Those are ways of developing social movements in which people could be declarative and say, listen, there's some depression here. What is the root cause behind that? It's a little bit different from saying, let's give them an antidepressant.
Right, right.
So.
And along that line of thought, older population is a force to reckon with, really. But how would you propagate this idea? How would, say, technology play a role in making this? Or maybe I should backtrack. Where is this idea so far?
Yeah, I'm relatively newly retired, and I was looking at my priorities, and this actually is one of my priorities to move it forward, and I'm just playing around with it a little bit now, and just trying to understand how to move it forward. But I think where the possibility for the gold card is really among the baby boomers, who have a significant degree of tech knowledge, and the whole concept would be that the gold card would allow a little bit of social networking, and it would be as much or as little as any specific person wants to be. But I think just to be declarative of saying, I'm a person, and I want love and dignity in my life. And then it could be even some things that actually had some commercial avenues to it. So let's say that you went to the gold page and it said there's discounts on this day for older people, or also a Bill of Rights type of things. Like, let's just say that older people became organized around specific issues like healthcare. And this is, how do you make it a gold card certified hospital? How do you make this a gold card certified healthcare system?
Wow.
How do you make it so that the access to services in this hospital setting, healthcare setting, is good? How do you make it older friendly? All these ways of creating power.
Wow. No, this is certainly a great business idea to think about, and it goes back to your point of saying that, well, older people are really not a burden. It depends on how you look at it. There are opportunities there. Now, how did you come up with this idea? Is this on your own, or did you did you come up with this idea with somebody, some of your other colleagues?
Actually, it was one of those kind of lost moments, because I'd done a fair amount of work within Kaiser about optimal design of systems for frail elderly, and there was an aha moment for me. It says, the worst that a healthcare system can do is when we do things to people. In other words, we do things that make their lives worse, like impoverishment, putting them in nursing homes. Those are the worst things we do. Then we do things sometimes for. He says, this is the way we should. And then, but the optimal is with. How do we kind of think about things together?
Let me see. Now, I'm glad you brought up that point, because you've done a lot of things with at Kaiser, and I guess looking back at your career, tell us some accomplishments.
Well, probably the major accomplishment, which it's still at a relatively early stage, was to subversively get Kaiser to stop thinking in terms of just a sickness model.
Why subversively?
Well, there was what I said was the purpose of the work I was doing, and then there was the ulterior purpose of planting a seed for moving things further along. But rather than just saying, Kaiser was actually a relatively traditional way of looking at things. It looks at diseases and says, how well are we managing diabetes in this patient or in this population? And from the perspective of a geriatrician, I said, that's about a disease care model. How well you manage a diabetic is pretty irrelevant to a person who's really healthy. It's also a little bit irrelevant to a person who now is already on dialysis and is homebound and is actually at the very last stages of life. And so I was able, kind of pushing and prodding in a lot of different ways, eventually to get physicians to work on a project in which we looked at seniors as belonging to 4 different care groups. One who are the healthiest seniors, in which basically the things that make a difference are way different from the people who just, who have chronic disease, but it's just a minor part of their lives. And then it was, again, different from those people who have end-stage disease, who are in and out of the hospital all the time, who have a significant burden of disease. And a lot of times it's not just about controlling the diabetes, it's about what kind of support system is there. How are they feeling about their diseases? And those things have a massive impact on the overall course. And then, of course, there were the ones who are actually very frail or functionally impaired. And at the end and I think the simplest way of thinking about this, Alice, is that for people who are homebound, the most important intervention you can do is see the person in the home. Do we have a system that does that now? Well, I'm kind of prodding in that direction, but the work that we ended up creating using the electronic medical record is now being used throughout the Kaiser system. So it's impacted about 1 million seniors within the Kaiser system.
So you talk about the home visit. So do you actually have a program where, I guess, healthcare professionals will go in and visit these seniors then?
Yeah, I mean, I'm retired from Kaiser now, but we created that program, and it was basically a high-touch, lower-tech program, and I think it actually is an extremely high-value program. If you think in terms of value of giving dignity to people's lives, and at a relatively low cost, it's an extremely high-value intervention, and I think that we actually need to think more in terms of high-value interventions.
That would be great. Warren, why don't we take a break, because I'd like to learn a little bit more about these programs, how long has it been in place, and what does Kaiser think about that? So when we come back from the break, we will continue our conversation with Dr. Warren Wong. He's a retired geriatric physician from Kaiser Permanente. We'll be right back.
I'm Hong Jiang, host for Asia in Review on Tuesdays.
And I'm David Day, host for Asian Review on Thursdays. Both of us broadcast our respective shows at 4 p.m.
And my topics tend to deal with questions related to environment, culture, history, and sometimes human rights.
And my shows tend to be on international business, foreign policy, geopolitics, and national security. And you can watch our shows live on the ThinkTech website at thinktechhawaii.com.
And you can also watch us on YouTube or Olalo.
So come join us on Thursdays at 4 p.m. I'm David Day.
And on Tuesdays at 4 p.m., I'm Hong Jiang.
Aloha.
Aloha.
Welcome back. This is ThinkTech Hawaii Biz Ed Spotlight. I'm Alice Li Hagen. With me today is my guest, Dr. Warren Wong. He is a retired geriatric physician from Kaiser Permanente. He had been practicing for over 30 years, but right now he is a clinical professor at the University of Hawaii John A. Burns School of Medicine. Warren, now you've done a lot of things during this long career as a physician, and you thought about this gold card idea, trying to give, well, not give back, but help maintain dignity and bring quality of life to the aging population. This is your idea, and I'm sure that there must be a lot of other ideas from perhaps your colleague, not only here and around the world. Can you tell us some innovative thoughts and ideas that you've come across?
Well, I think, first of all, that the care of the part that an older person plays in the community is a complex issue, and that what we've had thus far is we have different parts of the community that operate largely on their own with their own ideas about how to manage problems. So, there's the social services that always thinks of older people in terms of poverty and how do we manage poverty. There's the healthcare system that thinks in terms of how do we treat the diseases. But I think that what we actually need a kind of a community-wide approach is if this community really truly supports older people to make it a great place to live. How would that look? And there's some infrastructure pieces of it, but I really think that it really needs it's a complex question and really requires a lot of different pieces to come together. And not least of those pieces is what is the role of older people themselves. Mm-hmm. So I do know that we both heard Paul Tang talk.
Yeah, an amazing physician.
Yeah.
So maybe we can show the video for linkages, but before I do that, I think what you were talking about is this pilot project with the Palo Alto Medical Foundation, and it's a project called Linkages. Actually, it's just one part of this pilot project. I was reading up on the website about this whole community partnership program that they have. So Linkages, they said that it's a new community-based, multi-generational network designed to engage and activate existing resources within the communities to improve the health and well-being of seniors and family caregivers. I think it's really important that we include the family caregivers. As I said earlier on, I hear stories about even my colleagues who are younger than me having to look after their parents, and there must be a better way of doing that. So, producer, may I ask you to show the footage of Linkages, please?
Well, the time bank, it means new possibilities for me. I can give of myself and receive from others too.
A lot of people come and go, and this has now become an issue as I'm older. I was just thinking, my goodness, either they're dying or they're moving. And how do I meet people? And then when I realized that the whole idea was to help you be able to meet young and old people, that's what really interested me.
The reason I set up this particular exchange with the artwork is because I've had a box of my son's artwork sitting near my bed for years and never really put it up. I don't have any experience or knowledge about how to make a wall look really nice with art, so I needed some help.
I answered this exchange request because I had so much experience with art and hanging art and framing art over years and years, and I knew that I could help her hang the pictures and teach her some of the essentials so that she could do it on her own later.
The opportunity of getting together, the opportunity to exchange, and you can afford it. It's not something that you go home saying, well, this is great, but I can't afford it. Well, you put some work in there and you can afford it.
It's not about charity. It's about giving someone the gift of allowing them to give to you, because we all feel so good when we're giving. If you are nothing but a giver, there's an entire side of life that you've now closed yourself off to. I think that we should be as open and able to receive as we are to give. And we become better at giving when we're able to receive as well.
You cook a good meal and it's fine. You eat by yourself and it's fine. But if you share it with somebody, it's another feeling altogether. It's so important to contribute to any kind of society that we're living in, or else you just kind of like dry out. And I feel like that is one of the secrets of being happy, is to give of yourself. And without that, it's like life is like half-lived.
I was really kind of blown away. The time banking itself seemed like, wow, this is helping so many people. It seems like a small thing that once you get involved and invested in it, really can become incredibly powerful. I can't say enough good things about it. It's really been a wonderful influence in my life.
I still remember so well the presentation given to us by Dr. Paul Tang. I think his title is the Chief Innovation Officer with the Palo Alto Medical Foundation. For someone like me without any healthcare or long-term care background, I said, wow, this is like Facebook with a purpose here, connecting people. And I still remember after Dr. Tang showed that video, he was asking the audience, what do we notice? It's not just the older population, the younger people, people of all ages and ethnicity trying to help each other out. And going back to your statistics about how a lot of older people who are lonely, and it actually aggravates their health issues. So your comments on that video?
Yeah, I think it's really important to have community, historically there's a lot of emphasis on the role of the family. I actually think there should be a huge role of the community as well.
If I can interrupt you on that too, because before our interview you said that, okay, we've always been brought up to think that, okay, younger people take care of older people, but you have a different take on that. Do you want to share that with us?
Well, I mean, I think younger people can take old care, but getting back to the ratio of if you only have 2 younger people for every 1 older people, and with busy lives as well. I mean, I think older people have to take care of other older people as well. I mean, that would be one way of giving a sense of purpose to, and it's to have people do what they're interested in doing, and as well as giving them a sense of purpose. And I think kind of related to that is the whole sense of community. Is that I think that if you live in a nursing home, I think very few people would think of that as living in community.
Right,
you know, I mean, it may be in town or whatever, but it's not really living in the community. I mean, I think that not many people want that, but there's a statement, you know, the concept of aging in place was something that has been promoted for many, many years. And I've actually evolved my thinking because, you know, as a geriatrician, I would make home visits and you'd say, oh, this is what aging in place means. And you'd look for the house that was the most dilapidated on the block, you know, because the ability to take care of their own homes. And you start to realize, well, aging in place, you know, it sounds like a great concept, but it also means that people are living in places they can't maintain anymore. And on top of that, you start to realize, well, this person who's aging in place, their best friend is the television. You know, so
what can we do? Can we bring something like this pilot project from the Bay Area, Mountain View to be exact, where they are doing the pilot project? Can we do something similar here and incorporating your idea of a go-kart?
Yeah,
Is that possible?
I'd definitely love to see that move forward. Yeah, it's the whole concept of how do we create community. So I think there's 2 things we need to do. Is we need to have really original thinking about how to provide a supportive environment as we get older, and along with that original thinking, there's a significantly important role of technology, and when the 2 are merged together, I think that's when we'll have some of the true breakthroughs. Because this video didn't get into it so much, but there's a lot about technology, just monitoring, like. You know, when we talk about high-value care, I can tell you how many times that a family member would say, you know, or a patient themselves says, I don't want to pay this person just to sit at my house and watch TV on my TV. And I think that's a perfectly legitimate point. So how do you use technology to provide the service when the service is needed? And so there's this concept of determining points in time in which services are needed, and various methodologies for that, understanding routine behaviors and looking for aberrancies from routine behaviors to determine when there might be a yellow light situation or a red light situation, and then pulling in the services as needed at that time. And how do you pull in community services? Not always call 911, but how do you pull in the appropriate services that might be supportive at any given time?
So are we there yet? Or are
We're not there.
We're not there yet. Okay. Then my last question to you is, you, as I said earlier on, you've got a lot of great ideas, and of course also looking at linkages. We both hope that this will somehow, a version of it will happen here in Hawaii. So looking forward, you've been retired just recently, so what are the projects that you are working on right now?
So I've been involved in a number of different things. So I'm involved with one group called the Chief Medical Officers Group, which is a group of chief medical officers from a number of the hospitals: Hawaii Pacific Health, Straub, Queens, Kuakini, some of the neighbor island hospitals, Hilo Medical Center, and we've kind of gotten together to talk about things, and over a period of time we start to think about things that start to have a connection around. And one of the things we've had a connection about is how we can provide better care for older people and how might it look differently. And then I've also had the privilege now being retired to really reach outside the healthcare system, and I've been working with Hawaii Community Foundation a little bit in terms of just looking at the way other parts of the society are looking at trying, and so the part of linkages is it's actually pulled together a consortium of people who are not who see a problem, who don't know the answers, who see that the answer doesn't fall within their system, and trying collaboratively try and figure out what is a better way of doing this. And I think you know, there's a lot of business opportunities for this as well, because I think where there is an extreme need for high value interventions, which are not embedded in the way we do things right now.
And you're in a great position to do that because of your background and your passion with this subject. I wish you good luck, and I hope that you come back sometime soon to talk about the progress of all these projects.
Thank you so much,
Thank
Alice.
you so much, Dr. Wong. It's a pleasure to have you here. Dr. Wong and I have been talking about creating, developing opportunities to provide quality care, quality of life to our aging population here in Hawaii and maybe to some other places in the world. My name is Alice Li Hagen. You've been watching ThinkTech Hawaii Biz Ed Spotlight. Stay tuned for our next program, and do come back to join us next week. We'll see you then.